Let's discuss hemophagocytic lymphohistiocytosis, also known as HLH. It is a rare disease that usually occurs in infants and younger children but can also occur in adults. Children usually inherit the disease, but in adults, many different conditions, including infections and cancer, can cause HLH. If you have HLH, your body's defense system, called the immune system, does not work normally. Certain white blood cells, called the histiocytes and lymphocytes, attack the other blood cells. And these abnormal blood cells collect in your spleen and liver, causing these organs to enlarge, what we call it as hepatosplenomegaly. If we talk about the causes of HLH, there are mainly two types. One is the um, familial cause, and other is acquired cause. If we talk about the familial cause, if both the parents are genetically carrier of HLH, a child has 25% chance of having the disease. So a familial one will have 25% of chance if both the parents are the carrier. And if we talk about the acquired one, the major one is the viral infection, and the major virus that can cause this is EB virus, also known as Epstein-Barr virus. It can be caused by other infections as well as weakened immune system, and as well as malignancy or cancer. These are the acquired causes. If we talk about the symptoms, uh, the fever and the enlargement of the spleen, also known as splenomegaly. These two are the major symptoms and the first symptoms to be seen. If we talk about the other possible symptoms, it could be enlargement of liver, hepatosplenomegaly, the swollen lymph node, lymphadenopathy, skin rash, jaundice, lung problems including coughing and difficulty breathing, digestive problems including stomachache, vomiting, diarrhea, nervous system problems including headache, trouble walking, visual disturbances, and weakness. Let's talk about some laboratory findings, and the first one and the major one is low levels of white blood cell called natural killer cell, NK cells. NK cell activity is low here. Low level of white blood cells, red blood cells, and clotting cells called platelet. So there is thrombocytopenia, neutropenia, and anemia. So all three cell types are low. There is high level of triglyceride and LDH as well as triglyceride. And the other thing is low level of fibrinogen and high level of D-dimers and high levels of ferritin, which is an important point. The ferritin is high, but patient may have anemia. There are high levels of substance called CD25. This is very important. CD25 cells are higher in number, and which increases, usually CD25 increases in your blood when your immune system is stimulated. And another important test, which is a bone marrow biopsy, which is a diagnostic finding, and you take the sample of your bone marrow, which is the center of the bone where blood cells are made, and it should be examined under the microscope. Other tests may include genetic testing and blood cultures. If we talk about the treatment part of it, the mainly few drugs like chemotherapy, immunotherapy, steroids, antibiotics, and antivirals are the major considered for the treatment. If the drug treatment does not work, then there is an option called stem cell transplantation. In this procedure, healthy bone marrow cells from a donor replace your diseased bone marrow cells. The stem cell transplantation can cure HLH in most cases. There is no way to prevent HLH, but as a healthcare provider, continue to learn more and more about it, treatment improves. Most children who are successfully treated go on to live a normal, healthy life. Thank you.